Welcome to Unit 13, Modules 72 and 73. We're talking more about treatment today. Here are your learning objectives, and here is your vocab. So first, is psychotherapy effective? Well, that depends on who you are asking. Many Americans feel that it is effective, and obviously it has come a long way, so I guess it really depends on the time period, right? Post-1950, we have a lot of growth in mental health and mental health care, and just in terms of the available psychotherapy, it has grown widely. So from the client's perspective, yes, it is effective. 89% said they were at least fairly well satisfied after treatment. Obviously, people enter therapy in a crisis, and so when they leave it, they feel like they have gotten better. The crisis obviously is going to resolve whether or not the person is in therapy. So there's a tendency for the person to feel better regardless of whether they receive treatment. So when we look at case studies from clinicians, they also look at it as, yes, it is beneficial, because when they hear back from clients, they tend to hear about how the therapy was really helpful for the person. But of course, it would be more likely that they're going to hear from people who are feeling better and feeling like it was worthwhile than those who are feeling bad again. So that means we need to really look at the research. And the research says that, one, there is regression toward the mean, which means there's a tendency for things to return to normal. You're going through a crisis or you're having a lot of emotional trouble, you're likely to go back to the average, how you normally were, whether or not you receive treatment. When we look at meta-analysis, and this is an important word, and this means statistical procedure that looks at multiple studies. It looks at a whole bunch of studies, and it uses that data, combines it using stats to say, for example, is psychotherapy effective? Not just using one study, but hundreds of studies. And when we look at meta-analysis on the effectiveness of psychotherapy, yes, it is effective. 80% who receive therapy are better off than those who are untreated and on waiting lists. Different factors that impact the outcome. For example, if the problem is a specific problem, then it's more likely that the person will feel better after therapy. If the therapist is qualified and experienced and good, then the person is more likely to feel better. And if the correct kind of therapy is used on the patient depending on the problem. So all of this together is called evidence-based practice, where we're integrating what's the best available research for anxiety disorders, and what are my clinical expertise and experience with patients with this anxiety disorder, and looking at my specific patient here, knowing their culture, their characteristics of their personality, and their preferences, what should I be doing for them? So all three of those things combine to have the most effective outcome. And that's called evidence-based practice. So when we look at alternative therapies, we have to keep in mind the impact of placebo effect and that regression toward the mean factor. So people might try out an alternative therapeutic method that really might just be a pseudotherapy. There's no research to say that it's helpful, but they feel like it did help them because possibly of placebo effect and regression toward the mean. So one alternate therapy is eye movement desensitization and reprocessing. It's also known as EMDR. And this has the person pull up a distressing image in their head, and at the same time, they're using some visual stimuli to have their eyes dart back and forth rapidly. Now, 84 to 100% of single trauma victims across 4 different studies say, yes, this was really helpful. The treatment is 3 90-minute sessions. But the skeptics look at this and say, okay, so you're having them pull up this distressing, traumatic image, but they're doing so repeatedly in a safe and comfortable environment. So skeptics say, you know what, that's just behavioral desensitization with a bunch of like eye movement stuff that we don't know if that part really does anything. And so there's really not enough research out there or information out there as to why the eye movement would be helpful in reprocessing that. It might just be behavioral desensitization, according to the skeptics. There's also light exposure therapy, and this has been thought to help with seasonal depressive symptoms. So there have been several studies that show morning bright light does dim depressive symptoms. So there are 3 commonalities among all of these different types of psychotherapy that are definitely beneficial. The first one is hope, that idea that I don't have to always feel this way. I might be able to feel better. New perspective from a new person when someone's feeling stuck. And the last is that therapeutic alliance, which is a therapeutic, trusting, and caring relationship where the client and the therapist are really working together in that alliance to resolve this problem. And that is also beneficial. So also, when we're looking at the effectiveness of a treatment, we have to look at the differences in the therapist's culture, gender, and values and the client, because when those don't mesh, therapy is not as effective. So, for example, someone from a collectivist culture might have trouble with a therapist from an individualist culture. And there are lots of training programs and required training programs for cultural sensitivity, but there's also work to recruit more people from underrepresented cultural groups, because ultimately you might be a woman who's more comfortable talking to a woman, or you might be a black man who's more comfortable talking to a black man, or someone from a collectivist culture talking to someone else from a collectivist culture. There's so many different things, and religion, right, where the more types of backgrounds we have, the more people who might benefit from treatment. So we also need to talk again about preventing psychological disorders, and one factor is obviously resilience, so building resilience. Most people, again, do not have PTSD from a traumatic disorder. They demonstrate resilience. But when we're looking at preventing psychological disorders and we're looking at the people that do not come out of those situations okay, we generally, as a society, look at those people and say, oh, they're sick or they're crazy, right? And you're some way abnormal, and so we need to treat you and fix you because you're the problem. But if we look at it from a different perspective and say, you know what, it's not you. When I think about all of these experiences that you have gone through, it makes total sense. You are reacting normally in an understandable way to what happened to you. So we need to look beyond just the person when we're talking about preventing psychological disorders, because it's not just the person that's having trouble, it's more. That means big issues like sexism, heterosexism, poverty, racism, all of those things. Anything that can undermine a person's sense of personal control, their self-esteem, puts them at higher risk for mental illness. So we need to have more programs that empower people and teach others how to empower children, especially so that they are at lower risk for mental illness. So there are also drug therapies. So this is called psychopharmacology, and it's just studying the effects of certain drugs on our mind and our behavior. So one type is an antipsychotic, and these are generally used to treat schizophrenia, and they are antagonists. They block receptor sites. So in this case of schizophrenia, they would work to reduce the level of dopamine in the brain. There are also anti-anxiety medications, and these are obviously used to reduce anxiety, such as Xanax, Ativan, Klonopin. So these are help to lower anxiety, but one of the most common, or the most common, is called an SSRI, and I'm going to talk about those on the next slide. For antidepressants, these are drugs used to treat depression, anxiety, OCD, and PTSD. So it's not several widely used antidepressants are SSRIs, which are selective serotonin reuptake inhibitors. And these are agonists. They work by increasing the brain's norepinephrine and serotonin. So they're elevating mood and arousal levels. So some you might recognize are Prozac, Lexapro, Zoloft, Paxil. Those are all common SSRIs. So also, they found that people with mild to moderate depression, their symptoms can also be relieved from aerobic exercise just as much as medication. So medication alone isn't just a cure. It's not advisable, and no one really treats with medication alone. So a lot of studies show the best treatment is cognitive therapy and medication. And obviously, like I said, physical exercise. So mood stabilizing medication, the one that you need to know, most common, is lithium, which is a simple salt that helps with bipolar. Now there are also biomedical treatments such as electroconvulsive therapy, or ECT, and this is only for severely depressed patients where nothing else has helped them, and the person goes under general anesthesia. They feel no pain at all, and there is a small electrical current that is delivered, and they wake up after 3 sessions of once per week. About 80% who receive treatment improve markedly. There is also RTMS, repetitive transcranial magnetic stimulation, and this is also to treat depression, but it's using magnetic energy, and it's like pulsing on the brain to stimulate brain activity and improve activity in the frontal lobe to help with depressive symptoms. There is also psychosurgery, which is not very common nowadays, and it removes or destroys brain tissue. So one of the used to be very common in the 1930s, 1950s was lobotomy, and that is a surgical procedure to calm uncontrollable emotional outbreaks or violent outbreaks from patient, and it cuts their nerves that connect the frontal lobes to the emotional controlling limbic system centers in the brain. It's an inexpensive, really quick treatment. Definitely has barbaric-like aspects of it, and definitely was caused a lot of bad side effects, childlike behavior, kind of all sorts of problems. And so it really wasn't helpful, and actually in many ways was harmful to patients, and it is no longer used. So human brains and bodies were designed for physical exercise and social engagement. So when we're looking at preventing psychological disorders or helping relieve symptoms of things like depression, there are therapeutic lifestyle changes that someone can make to relieve those symptoms. This is a 12-week program that was designed for depression, and 77% of those who completed this program felt relief. So you can kind of look through this, but these are things that we've talked about before, like exercise, sleep, light exposure, social connection, etc. And here's this kind of a chart outlining those biomedical treatments. So your takeaways: the effectiveness of psychotherapy depends on the willingness of the client and their expectations. Psychotherapy has shown to be effective when we look at that medical analysis. It reduces the length of the symptoms that the person is experiencing, but there is a regression towards the mean, meaning like people tend to go back to how they were feeling after their crisis, regardless of treatment or not. Drug therapies have done a lot to improve treatment since the 1950s, and it's a reason why a lot of people no longer have to be hospitalized. SSRIs are the most widely used for anxiety disorders and depression and PTSD and OCD. Lifestyle changes can make a significant impact on those with mild to moderate symptoms. So that sums up our modules 72 and 73, and I will see you in class.